Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning, Mrs. Turner. I'm Dr. Roberts. I understand you've been having some health issues recently. Could you please share what's been going on?
Morning, doctor. Yes, I've been feeling off for quite some time now. Over the past 4 months, I've noticed worsening joint pain, especially in my hands and feet.
That must be uncomfortable. Do you notice any particular activities that make the pain worse?
It's particularly bad when I wake up in the morning. My hands are stiff, and it's hard to grip anything. Walking is tough too because my feet hurt so much.
I see. And aside from the joint pain, have you been experiencing any other symptoms?
Yes, I've been feeling unusually tired all the time. No matter how much I sleep, I always feel drained. I'm also having some stomach issues, bloating and sometimes nausea.
I'm sorry to hear that. It sounds like you're dealing with quite a lot. Have you noticed any changes in your appetite or weight?
My appetite is a bit reduced, and I've lost about 10 pounds over the past few months without really trying. I'm not dieting or anything.
Okay. Have you had any changes in your medications or diet recently that could explain these symptoms?
No, nothing new. I still take my thyroid medication as usual, and my diet hasn't changed much either.
How about your stress levels? Have you been under more stress recently?
Yes, there's been some stress at home. My husband's health has been declining, so I've been taking care of him too.
I'm sorry to hear that. Caring for a loved one can be quite stressful. Do you have any support with that?
Not much. Our kids live far away, so it's just me most of the time. My sister helps when she can, but she has her own family to look after.
That sounds challenging. It's important to have support, especially when dealing with your own health issues. Have you noticed any other changes in your health recently?
I think my vision is getting worse too. I used to wear reading glasses occasionally, but now I have trouble seeing even with them on. It's hard to read or watch TV for too long.
Okay, so to summarize, you've been experiencing worsening joint pain, fatigue, gastrointestinal issues, unintended weight loss, and changes in vision. Is that correct?
Yes, that's right.
All right, based on your symptoms, I believe we need to conduct some tests to get to the bottom of this. It sounds like there could be multiple things going on here, potentially including autoimmune issues. Have you been tested for conditions like rheumatoid arthritis or lupus before?
I was tested a few years ago, but the results were negative. Could this be related to my thyroid?
It's possible. Thyroid issues can cause some of these symptoms. but the joint pain and weight loss make me think there might be something else going on as well. I'd like to run some blood tests and imaging studies to investigate further.
That makes sense. I just want to find out what's causing all of this so I can start feeling better.
I completely understand. Once we have the test results, we can develop a treatment plan. In the meantime, try to rest as much as you can and let me know if your symptoms worsen.
Thank you, Doctor. I appreciate it.
You're welcome, Mrs. Turner. We'll get to the bottom of this together.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Hello, Miss Turner. I'm Dr. Singh, the internist here. How can I assist you today?
Hello, Dr. Singh. I've been dealing with several health issues that have been getting worse in the past few months, and I'm hoping to get some clarity on what might be going on.
I'm sorry to hear that. Can you tell me about the symptoms that have been troubling you the most?
Well, I've had these frequent migraines that come with nausea and sensitivity to light. It makes it very hard for me to concentrate at work. On top of that, my joints have been achy and stiff, especially in the mornings. I also feel like I'm getting tired very easily, even after just a short walk.
I'm sure that's been challenging for you. When did you first start experiencing these migraines and joint pains?
The migraines have been on and off for a couple of years, but they've become more frequent and severe in the past 6 months. The joint pain started about 8 months ago, and it's been gradually getting worse since then.
I see. Have you noticed anything that triggers or worsens these migraines?
Stress definitely seems to make them worse, and bright lights or loud noises can set them off too. Sometimes they just come out of nowhere.
And how about the joint pain? Does it affect specific joints, or is it more generalized?
Mostly my knees and hands. My fingers feel stiff in the morning, and my knees ache when I try to walk or stand for long periods.
Have you noticed any swelling or redness in those areas?
Yes, my knees sometimes look a bit swollen, and my fingers can get red and puffy, especially in the mornings.
Okay. You also mentioned fatigue. Has this been a recent development, or have you been feeling tired for a longer period?
I've been feeling increasingly fatigued over the past few months. I used to be able to walk my dog every morning, but now it's a struggle just to make it around the block.
I understand. Have you sought any treatment or taken any medication for these symptoms?
I've been taking over-the-counter painkillers for the joint pain and migraines, but they don't help much. I also tried changing my diet and drinking more water, but it hasn't made much of a difference.
Have you been diagnosed with any medical conditions in the past that could be related to these symptoms?
I was diagnosed with hypothyroidism about 5 years ago, but I'm on medication for that. I also have a history of migraines, but they were never this bad before.
Have you noticed any changes in your thyroid symptoms, such as weight changes or changes in your energy levels?
Not really. I've always been on the heavier side, but my weight has been relatively stable. My energy levels have been low, but I'm not sure if it's because of my thyroid or just the fatigue.
All right, have you noticed any other symptoms, such as fever, rashes, or changes in your vision?
No fever or rashes, but sometimes my vision gets blurry when I have a migraine.
Thank you for sharing this information with me. It sounds like there might be multiple contributing factors to your symptoms, so I'd like to do some blood tests and imaging studies to get a clearer picture of what's going on. We'll also review your thyroid function to see if it's contributing to your fatigue.
That sounds like a good idea. I just want to figure out what's going on so I can start feeling better.
Absolutely. We'll work together to get to the bottom of this. In the meantime, I can prescribe something to help with the migraines and give you some exercises that might help with the joint pain.
Thank you, Dr. Singh. I appreciate your help. I'm really looking forward to getting some relief.
You're welcome. Let's get these tests done and go from there. We'll figure this out together.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
Hi, I need to schedule a physiotherapy session as soon as possible.
Sure, may I know who your regular physiotherapist is?
Dr. Williams.
Is this an emergency? Did you have an accident?
No, it's not an accident, but my back pain has gotten significantly worse.
I see. Dr. Williams is booked for today, but we have an opening with Dr. Smith later this afternoon.
That's fine, but will Dr. Williams be available tomorrow?
Yes, we could fit you in tomorrow morning.
I've been doing exercises Dr. Williams recommended. Maybe it would be better for her to assess what's going wrong. I can wait until tomorrow.
Sounds good. I'll book you for the first appointment with Dr. Williams tomorrow morning.
Now look at question 26.
So, I'm sure you've all received the memo about our new telemedicine initiative, and you probably have mixed feelings about it. While it's clear that telemedicine has its advantages, especially in reaching patients who can't easily come to the hospital, it also brings new challenges. Some of you may be worried about technical difficulties or concerns over patient privacy. To ease these worries, we are implementing stringent protocols for online consultations.
But what about the added workload?
That's a fair question. Our aim is to integrate telemedicine smoothly without overburdening anyone. We've got a team specifically trained for the telehealth services to handle the additional load. Also, patients will receive a guide on how to set up their systems and what they can expect, minimizing disruptions to you.
So our routines will not be disrupted.
Exactly. We are setting it up in such a way that it should enhance our healthcare services, not hinder them. Management will be tracking the process closely to ensure everything runs smoothly.
Now look at question 27.
Mr. Johnson seems to be recovering well after the bypass. When can we move him to the general cardiac unit?
He should be transferred within the next half hour. All his vitals are stable so far.
Good. I've ordered some additional blood tests. I'm concerned about his clotting factors, given his history of deep vein thrombosis. Make sure we're checking his D-dimer levels and doing regular leg scans.
Understood. I'll add notes to monitor for signs of clotting, like leg swelling or chest discomfort.
Excellent. Keep me updated on his progress. If anything changes, don't hesitate to call me.
Now look at question 28.
Our next patient, Emily, has been dealing with chronic lower back pain. We've tried physical therapy and NSAIDs, but she's still experiencing discomfort. This is her first day for acupuncture treatment, correct?
Yes, that's right.
We're going to start her on a weekly regimen of acupuncture to target her specific pain points. Along with that, we'll also incorporate some cupping therapy to promote blood circulation. This combination has been effective for some of our other patients.
That sounds comprehensive. Are we planning to continue her on her current medications?
Yes, for the time being. The acupuncture and cupping are complementary to her existing treatment plan, but we'll reassess as we go, particularly if she shows significant improvement.
Great. I look forward to seeing how she responds to the treatment.
Now look at question 29.
It's tempting to think that once the surgery is done, the patient is out of the woods, but postoperative infections remain a significant concern, especially in emergency cases. Our hospital has done well in controlling these rates. We're at a 5% infection rate as opposed to the national average of 9%. In emergency cases, you won't have the luxury of time to prepare the patient, and they may already be in a weakened state. You've got to be vigilant about maintaining a sterile environment and prescribing prophylactic antibiotics. Additionally, it's not just the surgical technique that matters. How you manage the patient post-surgery can make or break the outcome. Patients with compromised immune systems or existing conditions like diabetes are especially vulnerable. So it's a team effort. Surgical skill, nursing care, and follow-up all contribute to preventing postoperative infections.
Now look at question 30.
How are you doing, Mrs. Williams?
Well, considering I've just had a new hip installed, I feel surprisingly okay. You said I'd be up and about sooner than I'd think.
Yes, hip replacement techniques have come a long way. You had a minimally invasive procedure, so you should be able to go home today.
That's fantastic. I had a friend who went through this 10 years ago, and she was in the hospital for days.
Times have changed for the better. You'll be using a walker for the first week or two, and then you can graduate to a cane. But I'd recommend no heavy lifting or strenuous exercise for at least 3 months.
3 months? Last time I had a minor surgery, I thought I could go back to my Zumba class in 2 weeks. That didn't end well.
It's crucial to give your body the time it needs to heal. When it comes to surgeries like this, rushing back into your regular activities could cause complications.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
I'm Dr. Lisa Johnson, and today I'd like to talk about long COVID, a condition that has emerged as a significant public health concern since the COVID-19 pandemic began. Long COVID, also known as post-acute sequelae of SARS-CoV-2 infection, PASC, refers to a constellation of symptoms that persist or emerge weeks or months after the initial COVID-19 infection. Long COVID can affect anyone, regardless of the severity of their original COVID-19 illness. While it's most commonly reported in adults, children and adolescents can also experience long-term effects. The symptoms can be wide-ranging, including fatigue, brain fog, shortness of breath, joint pain, and heart palpitations. Some patients report loss of taste or smell, headaches, and mood changes. The variability and unpredictability of these symptoms make long COVID a challenging condition for healthcare providers to diagnose and treat. The causes of long COVID are still under investigation, but several theories are being explored. One hypothesis suggests that lingering viral particles may trigger an immune response, leading to inflammation that persists even after the virus is cleared. Another theory proposes that COVID-19 may cause lasting damage to organs, such as the lungs, heart, and brain, which could explain some of the symptoms observed in long COVID patients. A recent patient of mine, Emily, a 35-year-old teacher, contracted COVID-19 in December 2021. Her symptoms were initially mild, with a low-grade fever and slight cough. However, weeks after her initial infection, she began to experience severe fatigue and brain fog that affected her ability to work. She also developed joint pain and struggled to concentrate. After ruling out other possible conditions, we diagnosed her with long COVID. Emily's story is not uncommon, as many patients with mild acute COVID-19 infections experience persistent symptoms long after their initial recovery. Long COVID has significant psychosocial implications. Many patients, like Emily, face challenges in their daily lives due to debilitating symptoms. This often leads to increased anxiety and depression, not just for the patients, but also for their families. The uncertainty of recovery and lack of effective treatment options can make this even more distressing. For treatment, a multidisciplinary approach is recommended. This may include physical therapy for muscle and joint pain, cognitive therapy for brain fog and memory issues, and mental health support for anxiety and depression. Many patients benefit from a gradual return to activity, with pacing strategies to avoid symptom exacerbation. However, research is ongoing, and there is no one-size-fits-all treatment for long COVID. In terms of diet and lifestyle modifications, a balanced diet, regular exercise, and adequate rest are essential components of recovery. However, specific dietary or lifestyle changes have not been definitively proven to improve long COVID symptoms. As we continue to navigate this pandemic, it's crucial to raise awareness about long COVID and its impact on patients. Research is underway to better understand the mechanisms behind this condition and to develop effective treatments. In the meantime, healthcare providers must listen to their patients and offer compassionate care and support. Thank you for joining me today. I hope this discussion has provided valuable insights into long COVID and the challenges it poses to both patients and the healthcare community.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Today, I'm speaking with Dr. Sarah Collins, an oncologist specializing in breast cancer, to discuss recent breakthroughs in cancer treatment. Breast cancer remains one of the most prevalent cancers globally, affecting millions of women each year. Dr. Collins, could you provide an overview of the current landscape of breast cancer diagnosis and treatment?
Certainly. Breast cancer continues to be the most common cancer among women worldwide, with more than 2 million new cases diagnosed annually. The early detection of breast cancer has improved significantly, thanks to better screening methods like mammography and advanced imaging techniques such as 3D mammography. Early diagnosis is crucial because it increases the chances of successful treatment. Treatment approaches vary based on the stage of cancer, but they typically include surgery, radiation, chemotherapy, hormone therapy, and targeted therapy.
What recent advancements in breast cancer treatment stand out to you?
One of the most notable advancements is the development of targeted therapies. Unlike traditional chemotherapy, which can damage healthy cells, targeted therapies specifically attack cancer cells by interfering with certain proteins that help cancer cells grow and spread. For example, HER2-positive breast cancer can now be treated with drugs like trastuzumab and pertuzumab that specifically target the HER2 protein. Immunotherapy is another promising area where treatments stimulate the body's immune system to attack cancer cells. The introduction of CDK4/6 inhibitors has also significantly improved outcomes for patients with hormone receptor-positive breast cancer.
Personalized medicine seems to be a growing trend in cancer care. How is it being used in breast cancer treatment?
Personalized medicine is indeed transforming cancer treatment, including breast cancer. The treatment is increasingly guided by genetic testing, which helps determine the molecular characteristics of a patient's cancer. This information can be used to select therapies most likely to be effective for that specific individual. For example, patients with BRCA1 or BRCA2 mutations might be candidates for PARP inhibitors, a class of drugs that are particularly effective in cancers with these mutations. Liquid biopsies are also being used more frequently to detect cancer-specific DNA in the bloodstream, allowing for non-invasive monitoring of treatment response and early detection of recurrence.
That's impressive. What are some of the challenges still faced in breast cancer research and treatment?
Despite the progress, several challenges remain. One of the main issues is treatment resistance, where cancer cells adapt to overcome the effects of targeted therapies. There's also a need for better treatments for aggressive forms of breast cancer, like triple-negative breast cancer, which lacks hormone receptors and HER2 protein. Access to cutting-edge treatments and clinical trials can be challenging for many patients, especially those in underserved communities. Moreover, the long-term side effects of treatment can significantly impact the quality of life for survivors, so there's a growing focus on survivorship care.
In what ways is research focused on improving breast cancer outcomes for future patients?
Current research is focused on several areas, including developing new targeted therapies and finding better ways to predict which patients will benefit most from existing treatments. There's also a significant emphasis on improving early detection through advanced imaging and developing blood-based markers for non-invasive screening. Efforts are underway to improve treatment for metastatic breast cancer, where the cancer has spread beyond the breast to other parts of the body. Additionally, researchers are exploring how to better tailor supportive care to address the long-term health needs of survivors.
What advice would you offer to women who are concerned about breast cancer or have recently been diagnosed?
For those concerned about breast cancer, I would encourage regular screening, especially if they have risk factors like a family history or genetic predisposition. A healthy lifestyle, including a balanced diet and regular exercise, can also help reduce risk. For those recently diagnosed, it's essential to work with a multidisciplinary team of specialists to understand the specific characteristics of their cancer and develop an individualized treatment plan. Don't hesitate to ask questions and seek a second opinion if needed. It's also important to lean on support systems, whether through family, friends, or support groups, to navigate the emotional challenges that come with a diagnosis.
Thank you, Dr. Collins, for sharing your expertise with us. It's encouraging to know that research continues to make strides in breast cancer treatment.
You're welcome. I'm optimistic about the future, and I'm confident that continued research will bring even more breakthroughs to improve outcomes for breast cancer patients.